using your voice to ask questions. If your background is noisy, feel free to ping us, and Kim will be managing those. Oh, great. The recording has started. Oh, okay.
Yeah.
So feel free to let us know if you have any questions at all. Feel free to interject. We'll keep this super open communication, and won't take more than an hour of your time. So does anybody have any questions before we go ahead and get started? Okay, and just to reiterate, this is for the 2021 plan year. Okay, let me go ahead and share my screen. I'm also on multiple screens here, so if I'm not looking directly at you, it's because I'm looking at the screen that I'm presenting. Can everybody see the screen?
Yes.
Okay, awesome. So let's get into your 2021 benefits. This is just a quick overview of what we will be looking at: eligibility and enrollment. We're looking at the actual benefits. You do have access to an employee assistance program. We'll look at the employer paid life and AD&D, then get into the voluntary benefits. Just a quick message from management. Santa Cruz values your contributions to the company. These benefits are valid through 2021. So these benefits that we're looking at, they will end at the end of December. And then you guys will begin your open enrollment at the end of this year. Your benefits may or may not change, but any changes will be communicated to you ahead of 1/1 of next year. This benefit guide, feel free to keep it in your back pocket. If you have any questions about your benefits, take a look at it. You're also more than welcome to reach out to the member advocate directly. We're here to help you. But in certain cases, it might be more streamlined to go straight to the carrier first, and then let us help with any lingering questions or issues. And I'll go over that as we get to those pages. Feel free to share this with any of your dependents if you need their input before you make any benefit decisions. And moving into the healthcare terminology. So we added a handful of pages here. I know you guys work in healthcare, so you probably understand all this terminology, but in case you ever get an explanation of benefits, or you go to the doctor and you're just wanted to have something handy to look at what the difference is between coinsurance versus copayment. If you are at the dentist and wanted to know what are major services versus basic services, or if you're getting a prescription and just wanted to know, what's the difference between brand name and generic or whatnot, this is just here for you in case this is helpful for you. Okay, so eligibility: all regular employees working 20+ hours a week are eligible to participate in Santa Cruz's benefit program. If you're a new hire, benefits start on the first day of the month following 30 days of employment, but I know that you guys, I believe, are already active and now you're being eligible for benefits. So that doesn't necessarily relate to you, but if you have any questions about your individual eligibility start date, reach out to the member advocate. Happy to go over any of those details with you if HR hasn't already. An eligible dependent is your legal spouse or qualified domestic partner, your children, which include natural, adopted, or step, and your qualified domestic partner's children. All children are eligible for coverage up until age of 26. Once you make your decisions for your benefits now, the next time you'll be able to make any changes to your benefits are through open enrollment, which happens before the beginning of the plan year, and we'll communicate what those exact dates are later on this year. They've usually fallen under November of most other years. So if you don't make your decisions or any changes now, the next time you can do it is during open enrollment, or if you have a qualified life event, you have 30 days within that qualified life event to make any changes. So just let HR know, and then they'll let us know. Some examples of a qualified life event are marriage, divorce, the birth or adoption of a child, death of a spouse or dependent, if you lose coverage elsewhere, if you move somewhere that your current benefits aren't available to you anymore. That doesn't happen super often, but if any of those happen, let HR know, they'll let us know. We'll make sure that you can make any changes to your benefits. This is a super important page. This is the contact information of all your carriers. For your medical insurance, you'll also get a card. You can also call the number on the back of the card. If you want to reach out to BRMS, who they are the dental, vision, FSA, and HRA admin, you can reach out to them through any of those phone numbers. There's principal information there as well. And once again, you can always reach out to us if you have any questions at all, but we do want to provide this just because sometimes it is fastest to reach out to the carrier. If you have a question about any of your medical claims, for example, we can help you with that, but we have to sign, and you have to sign paperwork first. And I know I've talked about the member advocate a couple of times, just some additional information in case you weren't aware of the member advocate. ICMS has a team that we're here to help you with literally any questions, any benefit, enrollment, ADP, anything like that at all. We work with HR, with you guys, to make sure you have all the answers to any of your questions that you have. You can not only, oh, I see that, not sure if the slides are advancing. Can you guys see that I'm on the virtual member advocate services slide?
Yes, I can.
Okay, so for anybody that's having a lag, we'll send this recording. We'll also make sure to send the benefit guide as well. So you just let me know if anybody's having any service issues. So not only can you reach out to the virtual member advocate at that email at the bottom, the member advocate at icmsbenefits.com. You can also give us a call at the phone number on that card on that slide. You can also schedule a face-to-face to us like this. So we're super accessible. We're here to help you. Can't stress that enough. Reach out to us for any questions. Okay, so the two medical carriers that are available through Santa Cruz are Kaiser and Blue Shield. We do have a Kaiser HMO, and we have a Blue Shield PPO plan. For a Kaiser HMO network provider list, feel free to go to www.kp.org. We also have a current PPO network provider list for Blue Shield at www.blueshieldca.com. If you have any difficulties finding any of that information, reach out to the member advocate. There's also a 24/7 nurse line, which is really great. You guys work in healthcare, you know how impacted some of these ER visits or urgent care visits can go. So having that 24/7 nurse advice line is always a great way to go if it's not an emergency. Kind of piggybacking off of what I just said, we just included this page just for a helpful tip when to use the ER versus urgent care. I know you guys work in healthcare. I'll go over it again though, that the ER really should be used for just the straight up emergencies, not only because it's going to save you a bunch of time, but a bunch of money as well. You know how expensive those ER visits can get versus urgent care, which is usually just a copay, save you a little bit of headache. Okay, let's take a look at the medical plan comparisons, the HMO versus Blue Shield. I'm not going to go super into detail about this because this is available to you. It is online as well, but happy to go over a couple of the big ticket items. And while you're going through this, if you have any questions, reach out to me. You can see that the Kaiser plan is an HMO, which means there's only in-network benefits. There are no out-of-network benefits. There is no deductible. There is a $3,000 out-of-pocket max for an individual and $6,000 for a family. What that means is as long as you stay in network with Kaiser, if you're an individual, the most that you're ever going to pay in a plan year is $3,000. I do want to note that these out-of-pocket maximums and the deductibles for the Blue Shield plan, they reset on the first of the year. So on January 1st, 2022, those deductibles and out-of-pocket maxes will reset. So if you met it during 2021, it will start all over again in 2022. You can see that for the Kaiser plan, for an office visit with a PCP versus a specialist, they are both $30. You can see that $30 copay for the urgent care versus the $150 copay for emergency room. Just another example of how great it is to try to take advantage of the urgent care if it's not a true life-threatening emergency. You can see that for the prescription drugs, there's a $10 copay for a generic and $30 copay for preferred brand. Does anybody have any questions about the Kaiser benefits? Okay, feel free to interject.
I just wanted to add one thing really quick. If you do select the Kaiser plan, it is an HMO, so there is not an out-of-network benefit. If you don't go in network, it is a non-covered service.
Yep, thank you for reaffirming that. Let's head on to the Blue Shield of California. So I want to start off the Blue Shield benefits by saying that there is an HRA involved with this plan, which is a health reimbursement account. That means that if you are enrolled in the Blue Shield plan, which as you can see has a $1,500 individual in-network deductible and an $11,000 family in-network deductible, that Santa Cruz generously offers first dollar benefits towards those in-network deductibles. So if you're an individual, an employee only who has enrolled in the Blue Shield PPO, you will have access to $4,000 on that HRA card. So that means as long as it's a qualified service and you're staying in network, the first day that you're eligible for the plan, you have that HRA, you can swipe it up to $4,000, which only leaves you out of pocket $1,500 if you're an individual staying in network. That's such a rich benefit. That's amazing. So keep that in mind if you don't feel like you want to go with Kaiser, that is a benefit with going to Blue Shield. And for a family, that means that it's you plus one other person on the plan. You have that $8,000 HRA, first dollar benefit, which is almost unheard of. It's fantastic benefit. You can see that for the office visit and specialist visit, urgent care, that we don't have copays, we have co-insurances. That's another reason why the HRA is offered, to help make you guys whole while you're waiting for that co-insurance to kick in. We can see that the prescription drugs, the generic copay is the same as Kaiser, that $10 copay. And for the preferred brand, it is $25 after your deductible. There's also the out-of-network benefits as well with Blue Shield. So you can go out of network, you're just going to pay more out of pocket. Any questions about the Blue Shield benefits? Or Kim, anything that you wanted to add?
Well, you know, a couple things. And I'll reiterate this later as well when we get to talking about how the HRA works, but you want to make sure you present your Blue Shield ID card at every visit. Don't just present the WEX card that has your HRA money on it. You need to present that Blue Shield ID card first to the provider. Make sure that gets applied to your benefits, and that the only thing the HRA can be used for are things that are covered by Blue Shield, but not covered because of the amount of your deductible. So office visits, emergency room, anything that falls under those categories, yes. But this is not like a free money card. This is not where you can go and get a massage. This is not something where you can go and swipe for a non-covered benefit, cosmetic procedures or things like that. It really has to be restricted to what is used, what is covered under your Blue Shield plan. And you just want to make sure you save those receipts because they may be asked for in the verification process.
And so after you exceed 4,000, then you just basically go to the chart that's listed there.
Right. Yeah, exactly. So after the 4,000, from $4,000 to 5,500, it is the amount that is there, the 20% or 30%, whatever that benefit is, in network or out of network, until you hit the 5,500.
And then after that, you're fully covered.
Correct. Well, no, sorry. After from 5,000, from 0 to 4,000, you're fully covered, because we're only talking single here because of your HRA card, right? Then from 4,000 to 5,500, you are responsible for 100% of the charges. And then from 5,500 to 6,650, you have the cost share, and then it becomes 100% coverage after that.
So the most that an employee only would be out of pocket is the difference between the 4,000 and the 5,500, and then the difference between the 5,500 to the 6,600.
Yeah, so 2,250.
Yeah, which is a lot less than the 6,650.
Yeah,
but that's also a worst case scenario, to have to meet your out of pocket max. Okay.
Is that per year or per incident, or?
That is per year. Yeah, so the deductible will restart. So if there was a catastrophe and something happened where you did meet your out-of-pocket max in 2021, and you met that 6650, then at the beginning of next year, that amount would reset, whatever that out-of-pocket max would be for 2022. But that's put in place to have insurance on the insurance basically for you, to make sure that you're not going out of pocket an exorbitant amount. And then Santa Cruz is so generous for offering that HRA to help make you whole. Okay, let's move along to Kaiser Medical. This is just an intro page to Kaiser. We'll go into talking about how there's video visits for Kaiser, which is great, especially with COVID world, right? You can download the app if you're on a smartphone. On this app, you can make appointments, email your doctor, have 24-hour telephone health advice, get your online medical information. If you have Kaiser, you're super comfortable with this app. It's great, really easy to use. If you have any questions about that, let us know. A couple frequently asked questions about Kaiser. Once again, if you do have Kaiser, you understand how this works, but if this is your first time, you're not super familiar with it, you can choose your own doctor. You just call in the facility and choose a doctor there. If you need care urgently and it's not an emergency, they can usually provide same-day appointments. If you need coverage while outside of California, when you're traveling outside of their service area, you're only covered for emergency and urgent care. So if it is a true emergency and you're outside of the Kaiser service area, you will be treated as a Kaiser member to take care of you and save your life, essentially, and make sure that you're covered. If you have an emergency, just call 911 or go to the nearest hospital. When you have an emergency, Kaiser covers the care from Kaiser providers and non-Kaiser providers anywhere in the world. So don't worry about, oh, I have Kaiser, I'm not going to be able to get access while I'm traveling. If you do have a true emergency, you will always be covered. And similar to the previous Kaiser pages, we wanted to make sure that you guys knew that Blue Shield also offers teledoc, which is access to licensed doctors 24/7 by phone or video. Once again, super great to have during COVID times. I know things are starting to get back to normal, but providers are still heavily impacted, right? So if you want to get started with teledoc, we have instructions here about how to set up your account. And you do pay $40 each time you use teledoc until you meet the plan's deductible. And then after that, it's $5 per appointment.
Real quick, not to interrupt, but we have a question from the chat for emergencies. Is there a certain hospital in Santa Cruz areas that is preferred for Kaiser patients? That is no. No matter where you are, for emergency services, you go to the nearest hospital. Now, if you're not sure and you kind of want to, I don't feel good, call the advice nurse for either Kaiser or Blue Shield, and they'll direct you to the proper location to go. Urgent care, emergency, etc.
Okay, and then just a couple helpful hints about Blue Shield. It's a little bit different than Kaiser. So if you need to see a specialist, you can go directly to any specialist. With Kaiser, they're kind of a gatekeeper. You need to see your PCP first, and then they'll refer you out. Not with Blue Shield. You can go to any specialist you want, just make an appointment. But depending on the procedure, you might need prior authorization. If it's not an in-network provider, services will be covered according to the schedule of benefits. So that just means that your services will be paid at the out-of-network level, which we did have those out-of-network benefits a few slides back.
I have a question.
Yeah.
Right now, I'm a Kaiser member, and listening to the information that Santa Cruz Community Health is providing for Blue Shield, how difficult or how easy is it to transfer from Kaiser to Blue Shield?
On an enrollment side, it's so simple. If you want to switch, as long as there's a circumstance that allows you to switch your coverage, if that makes sense. Yes, super easy. Just make the change in ADP and we'll make it. On your end, you would just need to, you couldn't see the same providers. You wouldn't be able to see your same Kaiser providers if you were enrolled under Blue Shield.
So you are or are not able to?
are not able to.
Right. So you basically have to switch over and start new with a new primary. Okay. Now, and you have to request medical records to be transferred and.
Yeah, yeah, because Kaiser's like its own island. They're really good at talking to each other, but they stay separate from everything else. But you can absolutely switch. If that's what's going to work for you, then we'll make it happen. On the enrollment side, it's super simple. On your side, you would just need to commit to new providers.
Thank you.
You're so welcome. Any other questions on the medical before we move on from that? Okay.
Alrighty. Well, let's talk a little about this WEX card that we talk about. The WEX card serves multiple purposes. The first thing it is, if you're enrolled in the Blue Shield plan, it holds the funds for your HRA. It looks just like a credit card, like you can see the lady holding there, that credit card. And it operates just like a credit card. So a couple things, you can be at the doctor's office and swipe it in their credit card machine. You can, if you receive a bill from your provider, you can pay with the credit card, like if they ask you to fill out the credit card number on a payment, or if you can call them and say, hey, here's my credit card number, just like on the back, you turn it over. It's got that little 3-digit code. It looks and acts just like a credit card, only it has a maximum amount loaded on it for your HRA benefit for the year. So that's number one. Number two, again, I want to reiterate that this is only, the HRA portion is only to be used for Blue Shield service, allowable services that are not covered because of your deductible. So the first thing you need to do, if you're, for example, if you're going in for just an office visit and you're like, hey, I'm just going to pay for my WEX card, it's my first dollar service, right? Stop first. You need to use your Blue Shield ID card first, because what happens, and I'm just going to roll out random numbers here. Let's say an office visit costs $250 and you just use your WEX card. You're going to swipe that and it's going to take $250 off. However, if you provided your Blue Shield ID card first, maybe the negotiated visit price by Blue Shield is $150. So then you're only going to be charged $150 instead of the $250. So a couple of things with that. All of your services, you need to keep those receipts. You need to make sure Blue Shield has seen the claim so that it applies to your deductible. And then if BRMS, who is the administrator of the HRA plan, if they request receipts from you, you need to provide those to BRMS. Because if you do not provide the receipts to BRMS on a timely basis, once requested, they have to shut off your access to your card. And this is all regulated and rules that the government puts in place so that your employer can provide that first $4,000 or $8,000 to you generously. We just have to have a lot of rules in place to make sure it's being used for the appropriate services. So that's important. The other thing is, and I'll get into this later, the WEX card is used for multiple things. And so it can be for your HRA, your FSA, your commuter benefit. We'll get into those down the road. If you're requesting reimbursement for your HRA information, you can pay it with the WEX card. But let's say that you were at the doctor and you forgot your WEX card at home and you paid that bill. You can contact BRMS and get reimbursed for that by submitting a claim. And you can submit a claim to BRMS you can do a paper claim, you can do an online through their portal claim, you can fax the claim. There's numerous ways to do that. And you'll get all that information along with your WEX card when you receive it. Okay. Let's see, a couple of things, and just to highlight, this is all highlights of the WEX card. Yes, you can use it for your prescription expenses. It is loaded with that $4,000 or $8,000 each year, and that amount, again, as Izzy said, resets every January 1. So for example, you have until December 31st to use your funds for your 2021 plan year. However, let's just say you went to the doctor on December 31st and you don't have the bill from the doctor yet. You didn't pay it yet. The date of service is in 2021, so you can use your 2021 funds against that date of service, and you have into 2022 to submit those claims. So you don't have to, it's not a cutoff date. If you spend all of the money on your WEX card, that $4,000 or $8,000, and we spoke about this when we went over the benefits, it then goes into your portion of the responsibility. So you'll either be paying the full portion if it's under deductible, or the shared portion, the 20% or the copay portion. if it is past the deductible amount, up to the amount that you owe for the entire plan year. Are there any questions about anything we talked about for medical? Because we're going to move on from medical now. And if you think of something later, just let us know. We'll be happy to go back and revisit. Okay. Let's talk about the dental plan. So the dental plan that Santa Cruz has a network of in-network dentists, and that is the First Dental Health Network. And that email address or website address is at the bottom of this page. That's where you would find the list of providers that accept this benefit. It is a rich benefit. You have a $2,000 calendar year maximum, so you can spend for each person on your plan. The employee and any dependents that are on the plan have up to $2,000 to use each year. There is no calendar year deductible. So the first time you go for a visit, it's automatically the benefits start paying. And diagnostic and preventative services, so exams, x-rays, sealants, fluorides, your normal stuff is covered at 100%. Very rich benefit. And if you would happen to have a cavity or anything you need restorative services, are 90%. And then if you have crowns, inlays, onlays, dentures, those are all covered at 60%. There is an orthodontic maximum of $1,500. That's a lifetime maximum. It is for children and adults. Also a very rich benefit. Very few plans that we have in place have adult orthodontic benefits. And the orthodontic benefit is a 50% coinsurance. Any questions regarding dental? No? Okay, let's go over to vision. For vision, there is no network of service providers, so you can go to any service provider. However, what that means is that the vision providers may not directly bill the Santa Cruz BRMS plan. You may have to take that claim and then submit it. But there's all instructions about how to do that regarding your benefits. There is a $425 calendar year maximum with a $10 copay. So the first $10 is out of your pocket. After that, the benefits kick in at 100%. 100% for eye exams, up to 1 per year. 100% for lenses, up to 1 per year. And then you've got frames once a year, up to 100%, and there's maximums listed here. Also contacts in lieu of lenses, so you can either do contacts or lenses once a year. So a very rich benefit. Any questions regarding the vision benefit? No? All righty. The next couple of pages, we're going to talk about rates. So here are the monthly rates for your medical. This page is for medical plans. So the top 2 sections are for Blue Shield and Kaiser for full-time employees, and then the bottom 2 sections are for Blue Shield and Kaiser for part-time employees. So let me show you to explain how it's laid out. The first column is the actual full Blue Shield premium. The second column is how much Santa Cruz pays toward that premium. The third column is the amount that the employee pays on a monthly basis. And the fourth column is the biweekly amount for your paychecks. Okay, so any questions regarding the medical rates? No? All righty, we've got the same thing on the next page for dental rates. We have the top section is dental, the bottom section is vision. So where the full dental premium in the first column, how much Santa Cruz pays toward that premium in the second column. The third column is the amount that the employee pays, and the fourth column is the biweekly amount that would be deducted from paychecks. This for dental and vision, these are 100% covered by your employer for single coverage. So single employees, every employee needs to sign up because it's free coverage. So don't skip signing up for dental or vision because it's free. There is charges for employees and families, but those are, again, add-ons if you choose to do that. Any questions regarding any of the rates? All righty. Move on to the next section.
Okay, so let's talk a little bit about EAP, which has always been important, but I think that with how hard the last 2 years have been, it can be extra important, right? Also, I'm hearing a little bit of an echo of my voice. Can anybody else hear that? Yes and no.
I don't hear.
It sounds like it stopped. So The EAP is an employee assistance program. And basically what it is there for you is if you need to talk to somebody about kind of anything that's going on in life, and it doesn't even have to be a hardship. It doesn't have to be that work has been really hard the last couple years. We've been inside quarantined. Life is so different, which all of those are valid points. But it can also be um, I'm in a transitional period of my life and I need some help transitioning. I need to talk to somebody about my sleep habits. I need to get better. I don't know, really anything.
I'm moving and I don't know what to do.
Yeah, all of that. So what it is there's a 24/7 phone consultation available to you. You can just call that number that's on the bottom there, that 800 number, the toll-free number. You can also go online to magellanhealth.com/member. And just get started if you need any help talking to anybody about anything, really. And if you need help navigating this, feel free to reach out to us. We're happy to help with that. One thing that I do really like to point out about this EAP program is that just because it's offered through your employer doesn't mean that your employer has any access to any of your information. It is 100% private, HIPAA protected. Any information shared between you and whatever provider you meet with is protected, and that stays between you two. So I just want to make that really clear in case anybody was thinking about not doing it just because it's offered through a company. It really just is an added bonus.
Yeah, I wanted to make that point also regarding the member advocate. Maybe there's some questions you want to ask. What do my benefits look like if I go on maternity leave? What do my benefits look like if I quit? If those are questions you don't want to ask HR, obviously, maybe you don't want to give them a heads up, whatever. If it's a private reason, just contact the member advocate. We do not share that information with your employer. It's completely confidential.
Yeah, thank you for bringing that up.
I have a question about them. So say your family is going through dealing with someone with Alzheimer's. Do they have information, like can they give you like links or connect you with someone to give you further assistance or programs or support groups or anything like that?
They absolutely should.
Yeah, the EAP can absolutely do that. They'll provide you with information and resources. Also, your medical carriers or Kaiser or Blue Shield, if it's for somebody who's on the plan, they will have direct benefit resources that you can have for those members. But if you're dealing like, say, your parent who's not on your medical plan, you can absolutely contact the EAP and they'll be able to provide you guidance and resources. Not necessarily a benefit covered on your plan, but those more type of, assistance resources.
Absolutely. Okay, let's talk a little bit about your life and AD&D policy through Santa Cruz Community Health. Sometimes talking about life and AD&D can be a little morbid, but it's a worthwhile conversation, especially because your life and AD&D policy is employer paid, which means that as a Santa Cruz employee, you're automatically enrolled in this benefit, and Santa Cruz pays for it. It is a $15,000 life insurance policy. The accidental death and dismemberment is the same amount. So basically, God forbid God forbid you die, your benefit is going to get that $15,000. Sorry, your beneficiary will be getting that $15,000 benefit. If it's an accident, then they get that benefit as well. So $30,000. In ADP, you can put in who your beneficiary is. And so you don't have to worry about this benefit. You're automatically enrolled in it. If you have any questions about making sure that ADP has the correct beneficiary, reach out to HR and they can make sure that that's taken care of. But this is just a bonus that Santa Cruz does for you.
And just a little word of advice from past experience, do not put a minor as your beneficiary unless they are the beneficiary of a trust fund. Because that, if unfortunately you were to pass, that those funds are held by the carrier until that minor turns 18.
It can get messy.
Yeah.
And if that $15,000 wasn't cutting it for you, Santa Cruz is offering a voluntary life and AD&D policy for you. It works the exact same way as the basic employer paid policy, except you take on the cost of this. It comes automatically out of your paycheck. You don't have to worry about it. When you are on ADP enrolling in your benefits, there is a lab calculator that lets you know that if I want $10,000 worth of coverage, how much is that going to cost me per paycheck versus $20,000 or whatnot. Voluntary life and AD&D, what the money would be used for is taking care of anybody that you might leave behind. If it's a mortgage payment, if it's childcare, living expenses. So whoever your beneficiary would be, just like basic life, they would be getting the benefit just like for voluntary life, just like they would for basic. Let's go into a little bit of what that coverage is. So the maximum amount for employees is $500K, but any amount over $50,000, you will need to submit an evidence of insurability for. You can purchase that coverage in amounts of 10, but anything up to 50, you're going to have to submit something to principal, a paper. They just want to know some health questions about you before they cover you for such a large amount of money. If you have any questions about those EOI, evidence of insurability, reach out to HR or a member of the ICMS team. We're happy to give you some additional information. You can also cover your spouse and your children for voluntary life. For the basic life, it's only you because it's employer paid. Since you're paying for this one, you can cover your spouse or domestic partner or your children. You cannot cover your spouse or children if you're not covered. So they can't have the benefit unless you have it. For your spouse, they can go up to 150K, but anything above $15,000, they'll have to submit the same information that you would have had to submit if you wanted to go above that. We call it a guarantee issue amount. So you're guaranteed a certain amount. Anything above it, you'll just have to submit some information. For children, there's a handful of options. You can do 2,000, 4,000, or 10,000. You just make that choice in ADP if you have a child, if you'd like to have them covered.
So you can't cover adult children.
It has to be a dependent.
Okay.
So yeah, a dependent is a child of yours that is up to age 26. Oh, and one thing that I want to talk about with the voluntary life and AD&D is these are really great rates that you get because you get them through the group. However, if you are to leave Santa Cruz as an employee and you have this coverage, you can keep this coverage as an individual with the same rates that you had under the group. So there is a portability or conversion. You can go from having the group benefit to the individual benefit. If that happens, if you have this benefit and you end up leaving Santa Cruz, just let HR know. We have like the portability forms for you that you just fill out and make sure that principal has it. Any questions about voluntary life? Okay. Oh, this is just a calculator page, trying to decide how much coverage you might want to get, depending on what that money would be used for. So like I said earlier, to pay off a mortgage, help with car loans, basic living day to day. But there's also that live calculator on ADP while you're trying to decide what coverage you want to go with. Okay, we also have voluntary accident insurance, which is similar to the voluntary life and AD&D in the fact that it is employee paid. So if you do have accident insurance, this comes out of your paycheck, so you don't have to worry about making payments or anything. And accident insurance is exactly what it sounds like. You have insurance on any accidents that may happen that are covered under principal's scope of the voluntary accident. If there is an accident that occurs, that amount that you are covered for just gets sent straight to you, and you can do whatever you want with that amount of money. So let's just use whole numbers here. And let's just say that you had some sort of accident that amount paid out $20,000. So if that accident happens, you submit your claim, you get that check for $20,000, and that is yours. You can do what you want with it. You can save it to help with medical expenses, or you can go to Hawaii. It's yours. That's the beauty of this benefit.
And just a real quick, it's an on and off job accident benefit. So if you were to if you trip at Safeway, that's an accident, or you run into a door at the office and something happens to you, any type of accident, on or off job. It's not restricted to on the job or off.
Which is fantastic. It's great to have that on-off job. Much more coverage. Okay, and then we also have critical illness, which is falls under the same umbrella, same as accident, except with critical illnesses. So if you are enrolled in this benefit for critical illness, God forbid, sometime down the road, you do get diagnosed with some sort of critical illness. Each critical illness has its own benefit amount. And if you do get diagnosed with that critical illness, you are covered. Same thing as accident, you get that check written out to you in your name, and it is yours to decide what to do with. This is just deciding how much coverage you might need, taking into consideration if you do have that critical illness, are you going to be maxing out your deductible for the year? Maybe travel costs to go get treatment or something like that. But on ADP, we do have information for what critical illnesses are covered and at what amount. Same with accident. And same with the voluntary life and AD&D, because for AD&D, certain fingers pay out more than other fingers. Same with your arms or your legs too. Not to get totally morbid. Okay, we also have a voluntary short-term disability benefit that's available to you for physicians and all other members. So everybody's covered under this. An eligible employee is an active full-time employee who's working 20 hours a week. For the STD, the elimination period means that benefits begin on the 8th day for disability due to injury or sickness. You will get a weekly benefit of 60% of pre-disability earnings, up to $2,500 a week. And the maximum benefit duration is 12 weeks. Any questions on the STD or any of the voluntary benefits we've gone over so far? Okay. Here we have the monthly rate. It is by age. This is per $10 of weekly benefit. ADP has a calculator and they will be doing the math for you. And we have LTD as well, which is long-term disability. The elimination period is 3 months. You get, same as STD, you get 60% of pre-disability earnings up to a maximum of $10,000 a month. And this is for physicians only. The next page is for all other members.
The only difference, sorry, go ahead, Izzy.
It's okay, same brain. The only difference is for physicians, the end of the benefit duration, the own occupation period is till the end of the benefit duration. And for all of the members, it's 2 years would be the length of the LTD. And here we have the monthly rates for that LTD coverage as well.
Okay, a couple quick things. Another benefit that's available to you is the flexible spending account. So this benefit is available to anybody who is your IRS tax dependent or on your IRS tax return. So spouse, children, if you happen to have, your nephew on your guardian and they're your IRS dependent, they fall under this benefit, not necessarily under your medical benefits. So there's a little bit different eligibility for these benefits. So even if you did not, say, choose to have your spouse on your medical benefit, you could definitely have them covered as a person who has eligible expenses on an FSA account. So just to keep those kind of separate. A health FSA is an account that allows you to take pre-tax dollars out of your check, redirect them into an account to cover expenses not reimbursed by insurance. So first, for example, if you're on the Kaiser plan, if you've got a copay or anything deductible, that would be covered. If you're on the health HRA plan, Blue Shield plan, you would first use your HRA funds, that $4,000, but then we have that gap, right? Where part of it is 100% covered by you and part of it is the shared benefit with Blue Shield. It would cover those amounts up to the amount, your maximum out of pocket. Let's say your spouse, again, child, is not on your medical plan with you here, but has a benefit through your spouse's employer. You could still pay with your health FSA program expenses that are incurred by that person on the other health insurance program, not necessarily on yours. So the health FSA is completely separate from your who you have determined to be a beneficiary or dependent on your medical benefits or dental benefits or vision. It can cover any of those expenses, okay? Whether or not they're covered by the HRA plan or the Kaiser plan. We also have the dependent care assistance plan. That's exactly what it sounds like. It is for dependent care. So either your child or your dependent, IRS dependent, it could be an elderly parent, could be an IRS dependent for you, and it would cover their expenses as well. The maximum health care amount to elect during a year is $2,750, and the maximum dependent care amount is $10,500. And currently what's happened is the government has made certain allowances for these plans that allow you to roll over your funds. So anything you elect to put in your 2021 account, if you don't use it by the end of the year, you can roll it over to use in your 2022 account. So it used to be a use it or lose it. If you didn't use it by a certain time, you had to lose it. It's not necessarily that way right now. It's just for this next year. We're hoping that they actually make that a permanent feature of these plans, but unfortunately, it's up to the government's discretion to make the rules for the IRS plans. So we just kind of go along for the ride. We were pretty surprised when they made some of the adjustments this year, and we're very happy and hope that they continue to make them. If you, and I mentioned earlier, if you have that WEX card, if you're on the Blue Shield plan and you have the HRA funds on your WEX card, and you go, it's your FSA funds are also on that WEX card. So if you go to the doctor, it will, and you swipe that card, it will pull first from your HRA funds. And if those are exhausted after that 4,000 or 8,000, then it will pull from your FSA funds. So if, for example, you go and you want to use, your dependent is not on your Blue Shield plan, excuse me, but you want to use the FSA funds, you're going to have to carefully do that because it will automatically pull first from your HRA funds, and the card doesn't know who the service is for, right? So you're going to have to be careful about using the HRA card for a person who is not on your HRA plan and trying to get it to pull from the FSA. That's a lot. It sounds like it's very complicated to do, and it's actually not. All you need to contact BRMS if you do swipe it and it uses HRA funds before FSA funds, you contact BRMS and say that should have been from the FSA account, not the HRA account, and they just go boop and it transferred over. It's pretty easy. You also submit claims through BRMS. Again, if you didn't have your card with you and you wanted to use your FSA funds or for dependent care, you just submit claims through BRMS. And there's an entire, when you receive your WEX card, there's information about how to do that online or through the app or through mail, all of those type of things. Let's see, there's a question, insurance premiums deducted to paychecks. Okay, so there's a question regarding if insurance premiums you pay through Santa Cruz payroll deductions are not pre-tax. Yes, they are. All of your insurance premiums that are deducted from your paychecks are pre-tax. If you open an FSA and route payments through the FSA, yeah, the FSA has nothing to do with premiums. So this is all funds to spend on healthcare not related to premiums. Your premiums deducted through your paychecks are all done on a pre-tax basis. Alrighty, want to go to the next page. We've got some examples of why you would want to use or utilize an FSA account. If it's going to save you money, you basically get a 40% discount, right, between state and federal taxes, a 40% discount on healthcare spending. So if you know you're going to be, if you have a child getting braces or two child getting braces, or you have a spouse that has a chronic condition, or if there's any reason you know that you're going to be using additional medical funds beyond those that are provided by Santa Cruz through your benefit plans, or if the person is not on your benefit plan, the FSA is the way to go. It saves you because your funds are taken out of your check pre-tax, redirected to the spending account, and reimbursed to you in full, so that you save any taxes that would have been on those funds. The other benefit that Santa Cruz provides is a transit and parking benefit. So real common if you need to park downtown Santa Cruz. There's two categories. There's transit, which is using mass transportation, buses, van pools, that kind of thing. And then there's parking. So you can elect to have $270 per month redirected into a parking and or transit benefit for yourself. And the same thing, you can use those funds to pay for those. And I forget what the name of it is downtown Santa Cruz, where it has that, you can buy parking passes and that type of thing. So you can use it for any parking or transit. Any questions on flexible spending, either health FSA, dependent care, or commuter benefits?
I have a question. So if I were to enroll in the FSA for my domestic partner, is there a separate card, or would I have to use my HRA and then call every time and specify that it's an FSA?
I'm going to answer that two ways. And let me tell you the first way. If it was your spouse, you can get an extra card, and that's not a problem. The IRS does not, unfortunately, recognize domestic partners. So I mentioned this earlier. This is unfortunate, but at this point, the flexible spending accounts are not available for domestic partners. They are available for spouses, dependents, anybody who's on your IRS tax return.
Gotcha. Okay, thank you.
Yep, sure. Again, the IRS is the last year they've made a lot of changes in allowing things. So we're hoping that there are things coming up that they will allow that they have not in the past. Okay. The next page has some information about how to process claims, and this is any claims, right? So BRMS is your plan administrator. They handle the WEX cards, they handle your HRA accounts, they handle dental, they handle vision. If you have an EOB question, if you have coverage questions, if you need assistance with a claim, if basically anything, they're there to help you, and their contact information is there in the middle of the page. Also, toward the bottom, we've got Blue Shield that has information regarding how to submit a claim. With Kaiser, you don't really have to submit a claim because you're at the Kaiser facility. You're basically giving your Kaiser card. It's just kind of internal there. But if it's Blue Shield, and you need to submit a claim, there's information at the bottom there about how to submit a claim to Blue Shield. And then regarding your FSA and transit reimbursements, there you can fax, you can email, there's a mobile app, all those type of things to get reimbursed on any of those programs through BRMS. And the next page is the most important, because we're going to now start clearly and slowly reading through all the legal notices, because just kidding, we're not. Just kidding, we're not doing that. That is the end of the formal presentation, but we are absolutely here for questions, anything you want to ask. Also the member advocate, while you're enrolling, while you're trying to decide which plans you'd like to enroll in. If we end this call today and you're like, oh, I forgot to ask, whatever, the member advocate is always available to answer any of those questions for you.
And HR will ensure that you have a copy of this benefit guide if you don't already. We will also be sending a link to this recording to them that they can distribute as well. And if we haven't said it enough, reach out to the member advocate for any questions. And we're here.
Okay, so there's a question in the chat box. Is there a deadline for making your elections prior to the first of whatever month you begin? Yes, there is. The election does not have to be prior to the month. You have within 30 days of your eligibility. So let's say you're effective August 1st. You have until the end of August to make that election. However, you won't have your card if you need services. You won't have anything. So the earlier you can elect, and if you said, if you want to elect on July 10th for August coverage, you won't be covered until August, but you'll have your card on August 1st in case you need to use it. So it's always better to elect early than after the fact, but you do have 30 days after your effective date to enroll in coverage.
And you might have gone over this already, but to elect, do we do it through ADP or? Yeah, okay.
Yep, exactly. And if you have any questions about navigating ADP, HR can help out with that.
Is there any benefits for pet insurance?
No.
Well, we have pet insurance through Benefit Hub.
Yeah, that's true. There is actually, Benefit Hub has a great pet insurance offer. I'm happy to pull some information for you, Devette, and send it your way.
Okay.
Yeah. Happy to do that.
Thank you.
You're so welcome. I know firsthand how important that is. Always.
Yeah, and that's an unexpected expense that you're like, oh, if I had insurance.
Oh yeah, my dog just had a whole bunch of imaging done a couple days ago, and man, it racks up quick. So I hear you. Okay. Is there anything else that Kim and I can help you guys out with today? Any questions? Go over anything else? I'm going to take that silence as a no. But thank you so much for your time, everybody. Reach out to Member Advocate. Let us know if you have any questions at all, okay?
Okay, thank you.
Thank you.
Thank you guys so much. Have a good afternoon.